Hi there, my name is Nicole Lujan, and I will be posting a rebuttal to Lily Montgomery's debate supporting the U.S. withdrawal funding from the World Health Organization. While Lily has made excellent points, I personally believe that the U.S. should not withdraw funding from the World Health Organization. Responding to points made about Dr. Tedros, the director, Dr. Tedros served as Ethiopia's Minister of Health from 2005 to 2012, where he led a comprehensive reform of the country's health system. He clearly understands what it takes to expand access to healthcare with limited resources. This is something that many developing states and states of LDC status are concerned with, even though our country may not be. He has a doctorate in philosophy in addition to a degree in immunology of infectious diseases. This has encouraged his advancements in making global strides to combat malaria, HIV and AIDS, and complications in maternal and child health, such as tuberculosis. His understanding of healthcare advancements concerning marginalized or developing countries is extremely important. If the U.S. wants to be seen as a global hegemon, policymakers may want to consider what it will look like to other nations if the U.S. withdraws support from international endeavors that aid those countries. Those countries that are struggling worse than we are in terms of basic social and public health efficiency may need additional support from the World Health Organization more than we do at times. But we still are an active member and still receive a lot of benefits from being a part of the coalition. So, Dr. Tedros is globally recognized as a health scholar, researcher, and diplomat with firsthand experience in research, operations, and leadership in emergency responses to epidemics. Additionally, all accusations were made with no evidence, and his personal words explain that he is on the side of peace. If the U.S. is determined to remain a global superpower, removing itself from collaboration with the World Health Organization may be detrimental, as already negative assumptions towards U.S. aid will be further stigmatized in certain areas, especially those that have benefited historically from the World Health Organization. Additionally, at times, the World Health Organization has more leverage than the U.S., even when they were voluntarily collaborating. In previous Ebola response endeavors in the Republic of the Congo, U.S. independent agencies were ignored while World Health Organization initiatives made strides and larger impacts in health progression. The world needs an honest agency that can provide objective, science-informed advice on all health-related matters. This agency must be accountable to all countries and must be free of industry or commercial conflicts. We know that Donald Trump has been one to politicize information. Do we believe future presidents will do differently in regards to health information if we are acting individually? Will we receive accurate numbers for ongoing or new coming health crises? Will we receive alarms and response measures in a timely manner? In fact, the World Health Organization was an easy target for Trump to blame the abysmal U.S. pandemic response on. The World Health Organization raised the highest alarm, a public health emergency of international concern for the COVID pandemic on January 30th. In response to the comments made on this being a delay of its own, earlier in the month, the World Health Organization informed the Global Outbreak Alert and Response Network partners about the cluster of pneumonia cases in the People's Republic of China, or Wuhan. These partners included major public health agencies, laboratories, sister UN agencies, international organizations, and NGOs. Any of these actors could have relayed additional information, or they likely did. We just don't know. Prior to this, time was spent activating incident management support team initiatives, ensuring coordination of activities and response across the three levels of the World Health Organization, the headquarters, regional, and country, for public health emergencies. Countries then responded on their own, acting urgently or not. Without word from who, when would the U.S. have responded to the rumor of a cluster of pneumonia cases in Wuhan? Perhaps this would have not been taken seriously or even addressed until further down the line. A study has estimated that there may have been 36,000 fewer coronavirus-related deaths in the U.S. if the U.S. had entered the lockdown a week earlier in March. A different research study also estimated that around 83% of deaths could have been avoided if measures were taken 2 weeks earlier. It was also suggested that 54,000 fewer people would have died had cities begun lockdown on March 1st. President Trump dismissed the entire report as a political hit job. For my last point, if the U.S. withdraws funds, They have lost money already spent on existing initiatives in collaboration with the World Health Organization, meaning they would be needing to be allocating additional lumps of sum to begin particular endeavors either from scratch or so be it. This means funds will be unable to be utilized to newer and more innovative projects, as they will be funneled back to make up for lost progress. This will additionally put the U.S. in a position where they may fall from being a frontrunner in conducting timely advancements and responses to health concerns. For the aforementioned reasons, I believe the U.S. should not withdraw funding from the World Health Organization. Thank you.